I think we're ready, Gracie.
All right. Equal good evening. Gracie Kelly Telsqui, Talitsaquathawali, Casta Chowiak tribe. My name is Gracie Kelly. I'm from Sts'ailes and a member of the Chowiak tribe. I'm a liaison for the cultural safety and humility and work on behalf of the JCC alignment team. So welcome everybody to our webinar tonight. I'm here to acknowledge the traditional territory of the Sts'ailes First Nations of where I'm working from. Individually, we can honor with our hearts and our minds the traditional territories that we live, work, and play on. I'd like to introduce Angela Paul qʊənat. She is the Executive Director for the Sts'ailes Community Care Campus. It's a First Nations-led primary health care clinic in the Fraser Valley. She has extensive background in First Nations, social and cultural development, community engagement, education, and health planning, program development, and implementation. Just before we go to Angela, I'd like to share a couple of housekeeping duties. Carrie will be monitoring the chat and be able to share back with Angela any questions that arise. And the webinar will be recorded to be shared later. So we just wanted to make sure that everybody knew of what the process was. So welcome, qʊənat. Welcome tonight. We're so grateful that you accepted to honor us with this space to share some teachings.
Good evening, everyone. I'm so honored to be stepping into your circle. Thank you so much, Gracie, for that beautiful introduction. qʊənat Telsqui, Talitsaquah, Sts'ailes. I'm just sharing with you my traditional name, qʊənat. I very proudly carry that on behalf of my family. Our traditional names connect us to our ancestors and to our family, and it also connects us in our cultural ways, in our laws of the land. It connects us to our roles and our responsibilities, which throughout my lifetime in the work that I've done, I've come to understand that is a big part of our own health and wellness practices in our First Nations communities. And I'm just so honored to be sharing a little bit of the work that we're doing with I can share the name of our new First Nations-led healthcare clinic. We have just recently renamed our work. It's Eyameth. Eyameth means shaping health together in Halkamelum. It's important for us to use our language because there's so much knowledge, including our health and wellness knowledge, that's held in the language. So the word Eyameth, a literal translation from Halkamelum to English, is that we're shaping health together. And if you break down the root of the word, there's a lot of meaning in it, even beyond that, shaping health together. And in working with our leadership and our Eyameth Society Board, which is my direct supervisors, the board of directors that I work with, for this is from the Society Board. They would like us to translate it as weaving health together, which gives it even more context. We're really aiming to weave together the best practices, mainly looking at our contemporary medical system and our traditional health and wellness practices and ways, and that includes traditional medicines. And I'm going to start presenting to you a little bit about our Eyameth project. And in a bit, I will also introduce you to my colleague, elder and traditional medicines practitioner, Matilda Charlie, aka Auntie Tilly. I will introduce you to Tilly in a little bit, who will also share with you all some of the work that we're doing in traditional medicines and why that is so important. So I'm very happy to be here. I'm very honored to be stepping into your circle respectfully and sharing a little bit of the work that we're doing. Thank you very much to the team here. Thank you again, Gracie, for that beautiful introduction. I was working with Tracy Elk and Carrie Chambers to make this connection and to set up this evening. So hands up to you all for all of your good work, and honored to be here to share with you. Now let's see if I'm able to start sharing in a way that you can all see. Yes, there we go, screen. So hopefully you're all seeing a slide here. The name here in red, as you see in the middle, can you all see this slide? Yes, the name here highlighted and bolded and enlarged, Eyameth. We really wanted to come up with a name that was community friendly, something that's easy to say, and using the Halkomelem language, we wanted to make sure that it was something that was, you know, readable and the whole community could aspire to. And as I said, it means shaping health together or weaving health together. We did some research and worked with the language team, and we had these other options here. So we came up with these 4 names, and the one that we settled on was Eyameth. And as I mentioned, to us, the meaning of that is shaping up to be weaving health together. And we have a logo contest. I can't share with you yet. We have a logo that has surfaced in a competition that we've recently done in the larger community. We called on Sts'ailes, Lakhamel, and Sts'ailes nations to submit ideas and concepts for a logo design, and we have selected one. We're just waiting to finalize some minor details before. So hopefully next time I'm able to talk with you, you'll see this new logo that is very much reflective of the work that we're doing. Now it's interesting because I don't know how to change the slide, because
try one of your arrows. Yeah, there you go.
Yeah, there it is. It didn't work, but I just was able to toggle. So this is the site plan, design plans here. As you can see, this is the front entrance that you're looking. It's the bird's eye view of the building. This would be the entrance way as you come in. There is a roundabout here as you come in. In this center part, we will have a welcome pole. When we cleared the lot, we had the construction team and myself do a walk around the lot, and we were fortunate that there was one tree that was standing there that was really the only one that was suitable to be used to carve a pole. So the way that we had sort of identified that was what we want to do is bring that ancestor, like we have a belief in that kinship to to all plants and animals. So we wanted to recognize that cedar tree that was standing in the back of the lot. We wanted to bring that cedar tree to the forefront. So as the lot was logged, we took that one tree and we are preserving it for a carver to carve a welcome pole that will go front and center here as you drive around. That pole will be there to welcome people into this space. We want to make sure that this space is meeting the needs of the greater community, not only the First Nations people in this region, but in the Fraser North region, there are probably close to 4,000 members, and the understanding is that about half of our people in this region are not attached to a family physician. So this will help to mitigate health risks. It will improve access to health services. It will address some of the gaps that are prevalent in the community in health services. It will prevent or minimize the overuse of ERs and walk-in clinics. It will also deliver health services in a way that is very proactive and focusing on early intervention and prevention, very community and family focused. We anticipate that there will be 15 FTEs when we're in full service. And as you can see in this bird's eye view right here, on the right-hand wing that you see, just off the center to the right would be the clinic. So there is the exam spaces in the clinic wing. And on the left-hand side, there's a kitchen and a gathering space down the back in the middle. And off to the left, that's a center of excellence. So we have a lot of opportunity for educational programming and collaboration coming together, preserving traditional medicines, traditional foods, nutrition workshops, making salves, making teas, sharing knowledge, all of those good things. There will also be in the clinic space, there will be a home hemodialysis unit. As you walk into the building, this will be your view. There's a roundabout, so there's a drop-off space here, and then in the backside area there's a nice sized parking lot that will service this building. And let me see. This is as you walk into the building, there'll be a space here for greeting, especially if there are any, especially if there are any events or training seminars, anything like that. We'll have a sign-in or a greeting space here. We intend to use bring nature inside and make it a very warm and friendly environment, very welcoming. Coast Salish art. We have RFPs out, actually currently out now for that welcome pole, as I had mentioned. As you walk in, there will also be welcome posts on either side of the door, welcoming people into the space. There will be opportunity for artwork. As you see, there's a mural on the floor. Some of the features in the ceiling space are some of the concepts that we've been working with, and bringing some of those elements into the space will make it warm and inviting. Eyameth will offer, this is our vision statement, offer patient-centered holistic healthcare that weaves together the best of Western medicines and primary healthcare models and traditional Indigenous health and holistic wellness practices. And this is again another view on the left-hand side of the front reception area, a nice seating area for people to use and access as they're waiting. It's a gathering hall, also, as you can see on the right-hand side of that left picture, all of those doors there can open up into a greater gathering space. So it will accommodate larger gatherings and events. And then in the right, yeah.
Sorry to go back a bit. You mentioned that you guys are hoping for 15 FTEs. Are those all physician FTEs, or will there be allied health in there as well?
Sorry, say that again.
The 15 FTEs that you referenced, is that for physicians, or will that also include other health practitioners, nurses, allied health?
Yeah, it's in total, 15
Okay.
in total. So the admin, you know, myself as executive director included all of the 15 positions. Yeah.
Okay, great.
MOA, all of that. I think I'm able to share a list a bit later on. On the right-hand side here is the secondary waiting area as you walk into the clinic space. So there will be the place, you know, the reception area there to check in. And then off to the right-hand side there, we'll go into the, so there's a corridor that goes along the left of that reception area where the patients will access, and then the staff side will be beyond that door that's secure there. And so you go along and you can access the exam rooms that are down the middle of the clinic space, so you can access from either side, if that makes sense. And then there's room for physio. There is like a rehabilitation room. There will be other spaces in this clinic that will be determined by community engagement, more specifically responding to the needs that are demonstrated in the community. So if there's a high demand for a certain type of health service, you know, then we can bring in a specialist, you know what I mean, for like a particular day or number of days, depending on the needs that are demonstrated in the community. So it's kind of exciting to be building the services that are very much community driven. One of the main focuses for this is to achieve attachments. So we will be recruiting a family physician. We're just now launching phase 1 of our services this year. So even before the building is built, so the ground blessing ceremony took place in March. And some of you may be aware that the Minister Adrian Dix made an announcement. Our service plan was approved in November 2022, and by the Ministry of Health and First Nations Health Authority. The funding was committed and at that point, and the official announcement was made in March of 2023. And so we're just working on, it's challenging because this work has really never been done in this manner before. So the mechanisms, you know, within the Ministry of Health and the First Nations Health Authority are being developed. And we're actually in a position where we're helping to develop those systems and structures that will allow for this work. We do have a charter between the First Nations Health Authority, Fraser Health Authority, and Sts'ailes and this Eyameth, formerly known as the Sts'ailes Community Care Campus or clinic. There's the whole capital programming that's happening as we speak. There is a soft launch that is taking place. 46090 Lougheed Highway is the location of this clinic. If anyone has driven up this way in Harrison Mills, you probably all are familiar with where the Sasquatch Inn is. We're kind of just past there on the Lougheed Highway, down what we locals know as the Beach Camp Road. The new health clinic will be located there. It is about just a little bit more than, the building here is a little bit more than 12,000 square feet. We originally had envisioned a pharmacy being in this building, but there was no funding for that. So we removed the pharmacy and took that over to allow for more space, more meeting space and more office space to ensure that we had the touchdown spot nice and cozy for practitioners to use, and with a private office that was adjacent to that space, and also a boardroom that is easily transitioned to accommodate different size groups and different functions. So it's been very exciting work. Shovels will be in the ground literally in the next week or in the next week or two. The lot, we have done a lot of work with MODI and with the FVRD to acquire the land. We've worked with the landowner to get a subdivision underway, so that is nearly complete. I believe in the next day or two, we're expecting that to be officially approved, and then we are waiting to purchase our portion of that lot. That is our subdivided portion of the property. Phase 1 includes this building here. Phase 2 will be rolling into the elders assisted living and pharmacy. Yeah, so there's a lot of kind of bigger picture that kind of interplays with what we're doing. There's quite a holistic vision that started many years ago. Most efficient, more officially, feasibility works began in 2008. Feasibility study report was published in 2012, and as I mentioned, in 2022 the service plan was approved. So it's taken all of those years to really work through the health transformation agenda in our province, and of course working through the heart of UNDRIP and DRIPA and those kind of guiding principles there that allow for this work. This next slide here shows the back.
Sorry, just before you go on, Lisa has a question as to whether the health center also incorporates a community kitchen.
Yes.
Yay!
So this,
good job.
Yeah,
that's awesome.
Yes. So that this slide right here shows the back of the building. It's showing here just grass and little shrubs and trees. This will actually be very strategically developed by our traditional medicines practitioner, Auntie Tilly, and our Aboriginal Rights and Title, one of our staff members who also does a lot of work with traditional medicines. We're building a resource library, and what we're wanting to do is identify the important traditional medicines and foods and plants throughout our territory and bring it here to this space that you see right here. There will be garden spaces, and through those doors right there, there's this large outdoor gathering area. There will be trails that come from those doors. There's a kitchen right inside there on the right hand side. There's a community kitchen. There will be dehydrators, freezers, large fridges, a lot of work surface space and storage so that we're able to process traditional medicines, salves, teas, medicines, foods. All of those things will be prepared right inside those doors. In the kitchen on the right-hand side is all the center of excellence portion of the building. You'll be able to come right out those doors and walk like down this area here. It is a sloping lot. We'll have medicines, gardens, and trails that go out down to the riverbed and out into the area right out here in the back. So hopefully that answers your question.
That's
Oh
amazing.
my gosh, does it ever? It sounds amazing and really well thought out. I love all of it. It's absolutely stunning to boot.
Yeah.
Yes, thank you.
Yeah, for sure. And then here's some traditional medicines. This is a picture of Tilly picking some medicines. So there was an opportunity for a handful of us community members and staff to go out with Auntie Tilly, and also a handful of other traditional medicines experts, I would say, in our community, where they come together and share knowledge. And one of Tilly's priorities is to work collaboratively with the other knowledge holders and our team to build a library of information. As you all know and are likely aware, the process of colonization, specifically residential schools and day schools, really annihilated the systems that we lived by, our knowledge systems that held this knowledge. The way the knowledge was sustained was through word of mouth and through our lifestyle, and having, for example, grandparents teaching young children, and our own education systems that sustained the knowledge of these traditional medicines and plants. So there have been interruptions in our knowledge systems. And so we're really reconnecting to those sets of knowledge, reconnecting to those places out on the land, out on the water, reconnecting to the knowledge holders such as Tilly, to make sure that we're bringing it all together, that we're collaborating, and that we're finding ways to document. And so it's almost like the Center of Excellence will become a champion and a library where we're holding this information, we're utilizing the information, we're bringing it to life. I'm also working on my PhD, and it's actually, before I even knew I was coming to this job, I submitted my PhD, my application, and I called it Restoring Knowledge Systems, and restoring our Weaving Wellness is what I titled it. Weaving Wellness, Restoring Our Knowledge Systems of Health and Wellness. So pretty interesting how this happened. And so it's very, very exciting time. Here's another picture. When I was hired as the executive director for this facility, the first person I hired was Tilly. And so here's a picture of Tilly and I out on the land. Very excited to be working together, making these connections, and preserving, I would say, reconnecting to and preserving these sets of knowledge and the places, almost like mapping the places where the traditional medicines are. This is, again, Tilly and I out on the land with our totes of traditional medicines that we would take back into the community and learn from Tilly and other knowledge holders how to prepare. So we bring it back, like skunk cabbage, for example, bring it back, wash it, prepare it, and then learn how to process it to make salves, and understand what those salves are for and why they're so important. And also where we're headed is we would like to work as we, our slogan says, is weaving together with modern medical systems to understand how we can work together to provide the best of the best. We've had medicine walks in the community, several opportunities for all the knowledge holders to come together and share information. Here's one of our groups that was out on the land. Here's Tilly on the right-hand side holding a handful of skunk cabbage. And
is that Tilly behind you there in real life? Because your background is blurred, and we can't actually see her.
Yeah, I'm going to introduce her in a second.
Okay.
And this is Stephanie as well. Tilly and Stephanie work very closely together. We were laughing here, Stephanie laughing because I was taking pictures of her, and I was saying, she says, yeah, I'm nerding out over here because somebody found, was it a mushroom? Yes. Yeah, it was a little mushroom. Somebody found a mushroom. So they immediately all were inspecting it, and they were all trying to figure out what it was. And Stephanie here had this Plants of the Pacific Northwest Coast book that is like a Bible that has a wealth of knowledge. Here's Tilly working with this elder here, who is very selectively picking skunk cabbage leaves, learning how to do it in a way that is in line with our sustainability practices. Taking, not all of this bunch, taking some and making sure that we are doing things in a way that will sustain the skunk cabbage and the other medicines and plants around as well. This is bringing together young people. Here's a youth member in our community with her mother here, and coming together, bridging the gaps with the young people in our community is really, really important. And again, our ceremonies and our spirituality will be a very, very important part of what we're doing in the center. This is a photo that I wanted to bring into this to show you and to highlight, it's a baby ceremony. And so in our traditions, what we've always done is honored the 4 stages of life. It's very, very important for us to honor and cover newborn babies when they enter into our world and into our families and communities. We cover them and we identify what they belong to, who they belong to, and that starts to put them on a path in life. And that's a part of our wellness strategy. That's a part of our holistic approaches to health and wellness, that connectedness to our ancestral ways, our practices around health and wellness, also connected to the things that we belong to, such as our sacred ceremonies, and connected to family. It's the intergenerational connections and how knowledge is passed down. It's also connected to our lands and to our waters and to some of those medicines that you saw in the previous slides. And here's a picture of Pat Charlie. We're out on the land in ceremony. This is actually our ground blessing ceremony for our building. And Pat is giving us a bit of the history and where this concept of this began. I would say probably 3, maybe even 4 decades ago. 1, 2, like back in the 70s. These discussions had taken place. And here in ceremony, we had our drummers in ceremony out on the land as we were guided through ground blessing ceremony. And then, of course, there's Minister Adrian Dix making the announcement for this work. And we are looking forward to actually a ceremony next week where Minister Adrian Dix is coming back with representatives from FNHA and Fraser Health Authority, and as well in our community. We're coming together rather than signing a memorandum of understanding with each of these at all the different levels. They're requiring us to sign MOUs and MOAs. What we're doing is coming together to commit in ceremony, following the laws of our land, taking this opportunity to really genuinely transform healthcare and immerse our work in a way that is in line with our traditions, in line with our laws of the land, bringing us together to bridge the gaps, sharing our different perspectives on health and wellness. Here's a picture of us at the groundbreaking ceremony, coming together to bless the ground where we'll be building the building on. That's us, Tilly and I, digging and marking a spot there in the ground in ceremony. And of course, celebrating that, work that started so many years ago. We're just so blessed to be at this point now where we are trailblazing, literally. I think that to me, nothing can be more exciting. And my last slide that I wanted to show here before I pass the baton over to Tilly is of a weaving. I'm a Coast Salish weaver, and so a lot of what I do, I see through this lens of the weavings, because the weavings, hold a lot of our stories and history. Our health and wellness laws are woven into the work that we do. And the blanket here, one of the first things we do in ceremony is we lay a blanket down. And when we lay the blanket down, we sorry, my grandbabies are walking in. It's just like a community affair out here. Once the blanket is laid, we build the work on it. And so in our ways, we say all of the work that we've been doing, all of the research that we've been doing, it helps us to understand why this work is so important. We understand how our ancestors have envisioned this work, how previous leadership sets of chief and council and elders in our even our greater community, how they envision this work moving forward. And we weave that into this type of a blanket that we lay down as a foundation. And so the foundation, or as I would say, the blanket has been laid, and we're really looking forward to stepping into this space now and building our work. One of the first things we do in any ceremony that we do is we call witnesses, and then we lay a blanket down. And if somebody's receiving a name, then we stand them on the blanket and we cover them in this way. And so we are doing our work immersed in the laws of our land, and really laying this foundation for the work to be stood up in this manner, you know, in a way that is good, in a way that's going to sustain, and also in a way that is safe and holistic and inclusive of everyone. So with that, I wanted to just introduce Tilly. As I mentioned, when I was brought on board, the first person that I hired was Tilly as the traditional medicines practitioner and elder, making sure that we are reclaiming our traditional medicines as very much foundational to the work that we're doing, and we commit to working together, you know, with anyone and everyone who's interested in healthcare, in the context of this work, to come together and genuinely weave together, you know, the best healthcare system and sets of services that we can. So I'm very, very excited to introduce Tilly. Yeah.
Sorry, before we move on to Tilly, just had another question in the chat, if you don't mind.
Yeah, no, for sure.
I think you already answered this earlier, but could you let us know, if you know, how many family physicians you guys will be bringing on, and also what considerations you take when recruiting those physicians?
Sure, yes. So I think that what I've seen in you know, in the service plan that was developed prior to my arrival is somewhere between 2 and 3. There, I believe, is 2 family physicians, a nurse practitioner, registered nurse. Very shortly, I will be posting for an office, a clinic manager. And the clinic manager, I envision being a registered nurse, somebody who has that experience to manage a clinic and build this team from a clinical perspective. I'm not a nurse, I'm the executive director. And so I want to make sure that we are very, you know, we're building the best of the best, and we're weaving together, you know, the best of the best. And so I'm very excited and eagerly looking forward to welcoming a registered nurse as the clinic manager on board very soon. We currently have myself as the executive director, Tilly as the traditional medicines practitioner and elder. I have an executive assistant, and I have just recently hired a wellness navigator. And the wellness navigator will start to very actively engage the community, the greater community, very actively and proactively start building some of the programs and services from a family and community perspective. Mm-hmm. And we will be working very closely with, you know, the children, youth, and family services, different branches, and making sure that we are also addressing you know, some of those needs in the community, family needs, and helping people navigate the system, and engaging in a way that people are feeling welcome to come and inform the work that we're doing as we move forward. The family physician, I look forward to hiring, I'm thinking spring or summer, whenever it starts to naturally grow and develop a need within the community. We do need to start creating those attachments. So I would anticipate in the next 4 to 6 months, we'll be recruiting a family physician, maybe sooner. I'm not sure. We'll see if somebody surfaces as the right fit. I will be interested in a right fit criteria that includes an openness and a willingness to work at a very grassroots level through this lens of holistic healthcare and genuinely wanting to work together to weave a system that embraces healthcare services and programming that is inclusive of everybody. So this is we have some serious gaps. We have to address some of the access or lack of access to services. We have a lot of trust issues in the community. We have to ensure that people feel safe and welcome as they come into this space. Having all of our service providers be very much proactive and very much approachable and willing to work as a part of a team. Yeah, I don't know how else I can describe that, but there will be sort of that right fit criteria that we're starting to formulate now as we look to recruit and build our team. I would envision our staff like a family physician working with somebody like Tilly or other elders and knowledge holders to case manage and to have that sort of holistic healthcare. I know that there's models, in other places of the world that are doing this very, very well. And I think that we have an opportunity here to do things differently. So yeah, I excitedly look forward to that. I hope that answers your question. The question.
Yeah, thank you. Just gonna ask you if you could stop screen sharing, Ange, so we can get a better view for when Tilly comes on. And just had one more quick question that maybe we could save for later regarding treatment services or beds, if that is also being factored into sort of the overall plan for the center.
Yes, I can answer that quickly now. We do have a very comprehensive vision at Sts'ailes, and it does in our vision very much connects with other like spokes in a wheel, other parts of our organization. We do have Telmuch, which is another department within Sts'ailes. They're working on very, very much needed treatment center beds. And a meeting most recently with Minister Dix has kind of identified that we're all in agreement that there's these needs, and that maybe a first step towards that work will be to create spaces for detox initially, and then we start to build from detox to a continuum of care. And so, yeah, there's a lot of strategic visioning that's happening. I have weekly meetings with our CEO and the capital team. It's called our Strategic Initiatives Group. And so we're constantly getting a pulse on what those needs are and trying to proactively and from a vision perspective, create plans and make sure that we're lining up with the other parts of our organization. So there's work that's happening in Children, Youth, and Family Services jurisdiction. We'll be working very closely with Eyameth. That's the Department for Children, Youth, and Family, and they're taking over jurisdiction. Telmuch is another one that is the treatment, the drug and alcohol and treatment programming. Of course, mental health will continue to be a priority. The work of this clinic will not take away, it'll just augment what's already happening with the health departments at Sts'ailes, Skalitz, and Lac-Hamel. So it's just meant to, pull us all together and fulfill the greater gaps in healthcare, so that we are increasing the number of attachments is kind of the key to this health clinic, the Eyameth health clinic work. So hopefully that answers your question.
Yes, thank you. Just want to make a note too that we have about 10 to 11 minutes. Or Anna, I'm sorry, are we going to 6:30?
We do have it till 6:30.
Time.
Whatever works best here.
Okay, then carry on.
So yeah, I'd like to ask Tilly to pull up her chair, and she's got some, I don't know if you're going to show those. Yeah. But I mean, the CD. Yeah. So yeah, Tilly had, we had a meeting yesterday, and Tilly, we could be here for days and days and days listening to what Tilly has been researching. Tilly is, what is the program that you took? Sorry, I'm going to let you introduce yourself now. I'm just going to shush and let Tilly introduce herself, but she has been studying, like it's like a lifetime of knowledge being developed as a knowledge holder, as a matriarch within Sts'ailes. She's been developed for a whole lifetime in our ways of traditional teachings and our own traditional education system. She has a lifetime, but she also did do a diploma program as well. So I'll let Tilly share a little bit more about that.
Sam and the rest of you for doing what you've done all your life to get the education that you have, for what we're about to do with our Sts'ailes, Black Bahamian, and Skowits. We are so fortunate to reach this into the future. Like Ange said, I get so emotional for what we're doing right now. And my parents started teaching me when I was young. And my great grandmother passed down her name to me, and it is Eyameth. And that's on my dad's side of the family. His grandmother was the one that shared this name with me, Eyameth from Sts'ailes. And and I just love that Anne just learned what she's learned through her education, through her lifetime of being our greatest speaker for what she does for us right now. And how many people have worked hard for this type of education that she has. And I'm so grateful. My hands are up to you, Ange, for our way of life. And how many others of you have done this too? Reached how far you are with your education background. And my hands are up to you too, and the others. And what I've done was worked with the elders out at Cocolita for a year. And I was so luckily learning from them. And I have a book from back then, and that's in the 1979 when I was lucky enough to get that book, and it just hit me right in my heart that this is what my mom and dad were doing with us kids. And not only that, other kids in our community that were learning from this. And I'm sorry if I talk too long. You can just stop me anytime, because I do talk a lot when I'm talking about our medicine here. What it really means so much to me and others, because they want to learn more about our traditional medicines, that it's all around us. And I was taught a prayer to be able to say to the medicines when you're going out there and picking it, And I've got a picture right here for the yarrow plant, and I'm holding the live one. This year we hardly had any water for the plant, and the plant is called yarrow. There's a white yarrow and this pink yarrow, and they're both, to me, it's like two people that have been raised the same. Their medicines mean so much to us of these plants. And what I had done with myself is, when our person whose name is Dr. Jeannie Paul, and she comes from, I'm trying to remember the name, and I meant to keep it in my head, but Powell River, that's where she comes from. And she went to Vancouver and got her education as a holistic medicine person. And then she went down the States and furthered her education in the body system. And that really helped her to turn around and be willing to share her teachings that she's learned through her lifetime. And I'm so grateful to her too. And my hands are up to her, because she's still teaching, and she's 86, 87 years old. And how many people has she taught in our First Nations people and the other Aboriginal people that wanted to learn too from her in the universities? How many has she gone to? I don't even know, but I know she's been out there. The last time I knew that she was at a college was in Merritt. So I'm just sharing with you, it was her that I learned this from at Seabird Island College. I was so grateful when she was there teaching about 18 of us in class. And she went from the beginning part of the traditional medicines to the body systems, and how to teach us which plants are really good for the body system for us. And to me, when she was doing that for us, it was like teaching us from her start of it to her part that puts you at the master's level. If not the master's level, the clinician level. That's what she taught us. So how many other people can do that kind of a teaching, and being Aboriginal Indigenous person that is so smart, because she read so many books, did so much education work for herself to be able to turn around and have her hand out and putting us forward into the future. Like what I'm doing right now is, I am willing to teach the people, our people, and anyone else that wants to learn how to work with the medicines, how to identify them, and how to know which each medicine does for our people, how it helps your body.
Tilly?
So, yes.
Hi. We had a question sort of related to that in the chat for you.
Okay.
They're wondering what challenges you see in creating a sort of database of these traditional plants and medicines, and if there's any precedent that has been set before in terms of catalogs or books and the like, where these are recorded. And do you see that database moving with the modern technology, similar to how the healthcare center itself is going to weave together traditional practices with contemporary medicine? Do you also see the same for the traditional medicines? Are you planning to store that information in some sort of electronic format, if you will?
Yes, that's part of the plan is being able to store it and have it. Maybe it might go into book form, but we haven't gotten that far yet. But we do have a staff member that knows how to catalog all this information for us. And he said by the end of November, he's going to work with me to be able to catalog it. And we are going to have some books that I have had the book list from Dr. Jeannie Paul, which these important books we're going to work with in our system to be able to, and I have the list of it, and I'll share it with everyone that wants to understand in these books, this is what you go for. But I can tell you from Dr. Jeannie's knowledge, she was very diligent in teaching us students how to work with the medical part of the body system and which medicines were the ones to work with it. And there's so many of our medicines. Horsetail. Horsetail is an amazing one that helps with your body system of the when you have an infection on your feet or wherever you have an infection. This horsetail medicine plant will help to take away that I call it pus. And there's another word for it, I know, but that one works really well for people's injuries. And same with this hazelnut. Who would have thought that hazelnut would help us? And I've got a picture of that and the information. I could read you the medicine uses that you can use. So homeopathy is so easy to learn if you're willing to take it and work with it. And same with dandelion. Dandelion is one plant that grows all over the place, and it helps with diabetic people. You make it into a tea, or you make it into a salve, or that's what the dandelion does. It grows all over, and we could be taking it and using it. So the education is so important, and I'd love to teach anyone that wants to learn about what all these medicines do here. We probably have over, what did that one person say? Over 900 medicine plants, and the trees and the ferns and what's the other one? Even cottonwood tree. That would help the buds of that tree when it first comes out in the spring. That's supposed to help with your sinuses, helps with your coughing, your sore throat. All of that helps to help with our health, to get rid of all that buildup of what do you call it again? Mucus, yes. Mucus for pneumonia, bronchitis. That's how much it helps you. So this dandelion is so well used for a lot of people. So if you walk into a place where they have all of that place, like Mission Pantry, they call it, and that's where they have the dried plants in there. And that's where I go and buy some of the dried. If I missed out on harvesting these medicines here, I'm just letting you know that's what you do. But I don't know if I answered your question. Sorry. Did I answer the question?
Yes, yeah, he said thank you in the chat. Yeah.
Okay.
And also, Josh, I'm just going to answer you out loud. This session is being recorded, so it will be available for people to listen to again.
A part of what we've been doing with between Tilly and I is really creating awareness in the community. So we're taking opportunities right now in phase 1. We don't have a building yet. We're working out of the community. We're looking forward to more community engagement out in the greater community. We'll be planning some open house and engagement sessions so that we're able to share information about what we mean when we say we really want to transform healthcare, provide, you know, some alternatives and help to fulfill gaps that are in healthcare, accessing healthcare services, but also learning about traditional medicines, learning and understanding the kind of self-advocacy that we can do, and helping people to understand, you know, like if we just are willing to listen and we have people that are willing to share information, we can find healthy alternatives to regular teas that we drink. So iced tea, for example, when we had our community open house session, like what we're doing here today, we didn't have a lot of time for what's happening today, but we do this about quarterly in Sts'ailes community. We look forward to doing it in the greater community as well. But what we've done is say, here's a natural Gatorade. And you can do this. You pick those little buds that grow off of a, you know, there's several trees, but you pick those little buds and you infuse it in water, and you just get a nice filtered water, purified water, whatever, and you infuse these, and it's very simple instructions that we give, and we get people to taste it. And the kids at the school were like so excited. They kept running around and they'd come back and they were just gulping. And then I would share with them that, like, in one of these, and it was, you know, a bottle of iced tea. Like, you go to the store and you buy iced tea. This is how much sugar's in here. And we have no idea what all these additives are. But right here, drink this instead. We know exactly what's in here. And it's something you can do pretty much for free, you know, right? Picking the little buds off the trees in your own yard and infusing it, like, you know, and then you can get fancy and you can say, well, you can add strawberries or mint or blueberries or lemon, you know. So yeah, pretty interesting. We made our own homemade green tea, and every time we do different things, and then we just share the little easy recipes. You can even go on Pinterest and find some of this stuff, but you mesh that with our traditional knowledge, and it's pretty amazing what you can do. And it's becoming like household conversation, and our staff here are becoming aware. And it's really, we can't know what we don't know. You know, we know now that sugar is poison. We understand pop is terrible for you, but we all grew up thinking, you know, that's just normal. We have a poverty diet, I would say, right? And so it's not just poverty. We were legislated into poverty with residential schools and with the systems that really oppressed our people in our communities. But it's not just poverty in the sense of economics. It's poverty in the sense of how we eat. It's the foods that we had access to or didn't have access to. We didn't have access to eat salads. Like, I grew up, we were pretty poor, and I look back on some of the food we ate that was like our normal food. It wasn't very healthy. Aside from when we'd get wild meat, fish, and bulligans, you know, we had access to really good traditional foods. We might have taken it for granted, not understanding that it's gold, right? Not understanding what we had and the wealth of that. But yeah, I would say we're really building awareness. We're really building awareness, and that's what we hope to continue to do through the Center of Excellence. For our center. And Tilly's been busy kind of leading us all in making salves and just sharing. So Tilly is she's kind of like a natural doctor. She'll be like, I noticed you were coughing in the meeting, and then I'll come back with a little note of instructions on my desk. She'll bring me a jar, and it's her homemade tea. It's like what we would call Indian medicine. It's our traditional medicine, and she'll bring it in a jar. She's like, you need to heat up this 3 times a day, drink a warm cup, half a cup of this, heat it up 3 times a day, and it literally works. Like, and so we had another staff member here who just happened to be sharing that she was losing hair, that she had some hair loss, and that it was really kind of getting worse and worse. Tilly came back the very next, she left and came back that afternoon with medicine that helped with that hair loss. And so there's so many things that is that we need to start looking at. What I think about from an administrative point of view is like, how do I talk to the Ministry of Health and with First Nations Health Authority to help them to understand that, yes, we want people to attach to family physicians. We have to be looking at those attachments. That's what's going to drive our budget. That's what's going to justify our existence. But what about the attachments, or I would say the connections that Tilly's making in preventing illness? Drink this and eat this, daily, and you'll prevent cancer. Well, this is important. We need to know this. We need to understand that we're in the driver's seat when it comes to our health and wellness. How can we do more of that? And when you asked earlier what kind of a doctor we're looking for somebody who's on board with that, somebody who's constantly in a state of inquiry and, understanding the traditional medicines. If we have a diabetic who's taking medication, can they also take this traditional medicine? How do they interact, and is it safe? That's the kind of all the practitioners, that's what we're looking for in this, is like people who are on board and really want to transform healthcare and put each client and their families back in the driver's seat in terms of health and wellness.
Yes. And what I'd like to share with you is our tradition is by word of mouth from years back, thousands of years, that our people used to share with word of mouth, because they didn't have paper and pen back then. They used to share word of mouth with their children and each other. And the words that they would say is to a plant, like the yarrow. You would walk up to this yarrow plant here, and you would be saying to the plant the prayer, "Thank you so much for being here. And my name is Tilly Eyameth, and I come from Sts'ailes." You would say to the plant that, you would wave your hand over it and give thanks to it, showing this plant that your hands are grateful for this plant coming in to where it grows. And you would say to this plant, "I'm coming here and thanking you for giving up your life for our people who need you, people who love you, for just growing, and you only have one life to give. And we're so lucky to have you here. So lucky, our people that need you. That's why we're taking your life." And same burns anything else that you're taking from Mother Earth. And we're grateful that you're here with your medicines to share with our people. And then you'd put your hands up gratefully, saying, the words that you're using for this plant. So always remember that they only have one life to give, and they're giving it to you to help the people. And there's so many medicines out there. I could share so much with you of these medicines and what you can do with these medicines to help the people. And thank you for listening to me. My hands are up to you in gratefulness, all of you, for being here and listening to what I have to share with you, because I'm always willing to help our people, always. And that's never, ever going to stop, because the way I am, I'm teaching others by how I talk. And I talk simply, I'm sorry to say, but it's just the way I am, the way I talk. And I'm grateful for Ange, and grateful for the rest of you for listening to me. Ocean. Yeah. Ocean.
Yeah, I would just like to also, I guess, by way of closing, just express my ongoing gratitude to Tilly. I'm so honored to work with Tilly, and I'm so proud that Tilly's the first person that I hired to bring into this work. I feel like that is the laying of the blanket. That is the foundation that we're building on. We have to restore, or in my way as a weaver in my PhD writing, I say restory. We are restoring our knowledge systems, and this is critical, making them make sense in a modern context. It's important to do this, and not just for our First Nations people, but to sustain this knowledge into the future. This is the way it's going to happen. This is the only way it's going to work, is if we all come together and we share our understandings, and we share concepts about ways of wellness and health, and it's very, very interconnected with everything, spiritually, emotionally, physically, and mentally, bringing that, all of the components of ourselves together, and really having a willingness to be open to all of the different concepts that come together to make up a holistic health and wellness plan, and strategy. I think that there's a lot of opportunity, and we're at a very, very exciting time, of transforming health in our province. We have a lot of support in the work that we're doing. It's growing, and I think that it's coming out of the pandemic, I think that there's a lot more understanding of why we're doing this, and how important it is. And so I'm just so grateful to all of you, very, very busy people, for taking the time out to come and to listen. And again, I'm just so honored to come into your circle, and thank you for listening to us and sharing this time and space with us.
Just wanted to
Thank you.
offer
Comments. Thank you.
Sorry, Angela. Just wanted to offer my gratitude to you, Angela, and to you, Tilly, for taking the time to honor us with your special teachings and special words, and look forward to coming to the Eyameth Center, and just being there with you and learning about everything that you've done. It just is humbling knowing that we are there for our people, and so much gratitude to you both for sharing tonight. Thank you.
Thank you for all of the links and the information shared in the chat. And definitely open to anybody reaching, if you want to reach out. My email can be shared by the team. Tracy and Carrie, feel free to share my contact information if anybody would like more information, or to connect. I'm open to that.
Thanks so much, Ange. And just for, we're going to send out an email as well, but Britt has just popped the sessional form link in the chat if anybody would like to grab that before we close.
Yeah, and I just wanted to express my gratitude and to Tilly, Angela, for your presentation tonight. Just sharing your beautiful work in medicine was beautiful, and something a word that came to my mind at the end was "let's not." One heart, one mind, as you shared that with all the providers here, and I know that it made an impact tonight as I'm looking at all the comments. So thank you for the offer of sharing your contact information. I'm sure people would appreciate reaching out and probably have further questions. So thank you.
We will be creating, now that we have our logo is underway, we have our name, Eyameth. A big focus of mine in the coming weeks and months will be on PR. So I will share information, any links that we have. We will have a a website coming soon. Yeah, we're a team of just 4 of us right now. So we're looking forward to continuing to build this vision out. And definitely look forward to meeting some of you in person. Would love to host one of your meetings in the future in our Center of Excellence when we, around this time next year, we'll be looking at moving into our building. I think feasibly, we're probably looking at January of 2025, feasibly, right? About a year is what we're being told for the building to be opening. But thanks again.
So exciting. Thanks again, everybody. Have a good night, everyone.
I love you too.
Thank you, Angela. Thank you, Tilly. Thank you all. Yeah, wonderful work. Amazing, truly. Thank you.
Thank you.
Good night.
Good night.